Thank you so much. It is my pleasure to welcome, last but not least, our third panel to discuss research innovation for health equity.
I want to start the conversation just by asking, if that's our past, where are we right now? What's the present? When we talk about research innovation and the current state of play, where are things in terms of measuring for health equity?
I'd be happy to start. Thank you, Cameron, for the great question, and thank you for the invitation to be here today. If you look at the past, what you see is that a lot of the interventions that we were trying to implement to reduce health inequities, health disparities, have often been unidimensional. What I mean by that is that they target one specific social need, for example, or social determinant. And they often were targeted at the individual level. So, target that population or this group in the community. And I think where we need to go in the future is actually to develop more multi-level, multi-dimensional interventions that address multiple social determinants of health at once. And we need to address them at the more upstream level.
From a research standpoint, what's missing? What are we missing in our current paradigm in terms of how to effectively study what we need to study to make sure that we're creating opportunities for everybody to achieve their best health?
I can start. We had a lovely conversation in our panel about genomic data and how it lacks representation from all groups, that we'd like to see that. But another example comes to mind, which is in the immunotherapy field. That's an exploding new group of therapies for a lot of diseases, including cancer. And there's some really interesting research that I've read recently that shows that many of the targeted therapies that are being developed for immunotherapies rely on this specific HLA allele that is actually very prominent in mostly white populations in the Americas and Europe, but doesn't represent the rest of the population in the world, Asian populations, African nation populations. And so, as it turns out, this is going to get worse because of all the therapies that are being studied, somewhere along 80% are specific for that allele in Anglo populations. And so I think we're going to see health disparities continue to widen. And how do we fix that, which is what your question is. And I think the data sets that we use, the samples, the biosamples that we use, they really need to have the representation that we need of all populations in order for us to not develop therapies just specific for one group, which stands to widen inequities.
We know that so much of our health data is based on subjective impressions of race, and that's challenging, right? Especially in healthcare settings. But how can we get to a point where we do have the data sources that we need to effectively research a lot of different health outcomes, and particularly taking note of the disparities therein?
Your question is very timely, and there's actually a National Academies committee on this topic. And I agree with Eliseo that race is meaningless biologically because it is a social construct, but it does have consequences that we need to investigate when we're measuring biologic phenomena. So the real question is, if race doesn't have a biologic meaning, what is it being used for? When investigators say, this racial group has a higher risk of this or a higher risk of that. And that's the question that investigators haven't answered. What is race a proxy for? Is it socioeconomics? Is it the genetic diversity that we sometimes see in our populations? Is it culture? Is it something else? And so I think we as investigators have not done a good job disaggregating what are those variables that race is a proxy for that we're seeing as signals.
What do the next 5 or 10 years look like, ideally, in terms of our approach to researching for health equity?
I don't know if it's an ideal approach, but I think that AI, this is the Office of Science and Technology, and we haven't talked about AI, stands to transform everything, not just healthcare, right, but every sector, whether it's education, the military, defense, you name it, it's going to affect everything. And AI has, in my experience, been a wonderful tool that can help potentially change paradigms. I'll give you a quick example. My colleague Ravi Parikh and I are working on, I'm a cancer screening investigator, and we're using AI to actually predict who's going to have a positive screening test. Because if you think about screening, any kind of screenings, most people are not helped by screenings. They get a negative test. There's a few people that have a positive test and they're helped by screening, right? We found their disease early, we might be able to intervene early. But the majority of people don't benefit from health screening. Maybe they have peace of mind that for another year they might not need a mammogram or whatever the test is. So what we're trying to do with AI is we're trying to identify and predict who are the people that are going to have those positive tests so that perhaps we can concentrate our limited resources like navigation and healthcare resources on that population that really needs to have that screening test.
I guess the last question I'll ask, and then we'll close, is just this idea of who are the researchers, right? As we're innovating, where do you think we need the most support and help from a diverse and kind of robust group of young up-and-coming researchers kind of speaking to our future? Where do you think the most need is? And we'll close with that.
Well, I can say that some examples that we've used in Philadelphia have really focused on the public schools in Philadelphia to identify future researchers down the line that might not have had the opportunity. And so I think that that's really important for us, a source of future researchers and for diversification of the research workforce. But you have to reach out to them young and plant that seed, because it is a long road to become a researcher. It's an expensive road. So many costs are associated with that decision, both financial and non-financial. And so it's not just merely engaging those populations, but also how can we develop the means to support their retention in that pathway towards becoming researchers.
You want to thank our panelists for joining us today, and thank you all for coming.